Today, I want to talk about booster vaccines and goals of the pandemic as we look forward. So, booster to the mRNA vaccines, Pfizer and Moderna vaccines, has been recommended for all adults starting in September after 8 months since you received your first vaccine. So, that rollout of the one vaccine will be timed because of the time that you received your last dose of your vaccine. The Johnson and Johnson, there may also be a recommendation for a booster for that one, but it came out later than the two mRNA vaccines, and so we'll have data on that now. So I have a little bit different thoughts on that than others, and then the recommendation. I feel like we should be helping other countries first. We have a two-shot regimen that works well. It does prevent most all systemic illness. Now, there have been studies recently, and we know this from the very beginning. When we said that these vaccines are about 95% effective at preventing infection, we knew that they wouldn't be 100%. So when you see breakthrough infections of vaccinated people, it was expected, it was known that was going to happen. As we have some follow up studies, one was from New England Journal of Medicine in July, and it was the Israel cohort and the Sheba Medical Center. They followed through April some of their healthcare workers, and so they were watching them closely. They were around the virus very regularly. They were vaccinated, and so they followed a group of about 1,500 of them. Out of those 1,539 had a infection. Some of those were asymptomatic. Most all of those were very mild. None of those were serious. None of those led to death. So the vaccine did its job. For the vast majority of people, it prevented infection. For a small number, they still had a breakthrough infection with vaccine, but it was very minor. Exactly what we're wanting from most any vaccine. And this vaccine is actually probably more effective than some of the vaccines we've had for other things in the past. It is very effective and it continues to be. So I feel like our two-shot regimen is still working great for the vast majority of us. So why a booster right now? Well, part of that is because of the Delta variant. With this Israel study that was done, and there's others like it that look at the breakthrough infections with the vaccines, mainly was earlier in the pandemic and with the alpha variant of the uh, coronavirus, SARS-CoV-2. This is now we have Delta, and it's more transmissible, and we're going to have more breakthrough infections with Delta. So I think that's what pushed our public health policy towards a booster. It's not unreasonable. I'm not saying you should protest this booster, but if when it comes to public policy and it comes to global equity, we have countries that have no vaccines whatsoever, and we're lining up for a third vaccine. I do have a problem with that. I'm going to wait some time before I get mine. I can't wait too long because of responsibility to my patients. And I know that people will make similar decisions in the United States about getting that third vaccine. But when and where we have the ability, we need to push our public policy towards sharing our surplus vaccines with other countries. Now, that is happening. There have been deliveries made to India. There's been deliveries made to the Caribbean. I think there's been deliveries made to Africa from our country. I just want us to see more of that and to see this more as a global pandemic that it is. Our fate in the United States, the fate of the entire world, is tied. If we continue to have this virus in other parts of the world and it's raging and rampant, it will continue to mutate and it will come back to us also. We can't say that we're just our own corner of the world with this virus. Okay, now, what are our goals with this pandemic? Um, I think a lot of people feel like we're going to eradicate this. I don't think we're going to eradicate this. The virus is not going to go away. It's going to be with us for the next several years. We are still going to be taking pandemic precautions, I think, for a year or two into the future. I don't know how long it's going to be, but it's not going away anytime soon. What are we looking for? We're looking to actually downgrade this. As people develop immunity, I've had a vaccine. I do have immunity, and it gives me immunity to this specific SARS-CoV-2. Now, there was a very interesting study that was done, and this was done by a group in Singapore. So they looked at survivors of the original SARS-CoV-1, which we just called SARS-CoV at that time, or SARS, from 2002 and 2003. That epidemic had about 8,000 infections and 700 deaths. It was a very severe virus. It wasn't as transmissible as our current COVID 2 virus. So there are survivors, and they were able to get several people that had that virus and survived, and take their sera, and then look at those that sera or their antibody levels after they were vaccinated. So they looked at several cohorts. They looked at people who had SARS-CoV-1 who were vaccinated, and SARS-CoV-2 and were vaccinated, and they tested, and this is all in vitro, so we don't have real world studies yet on this. But in vitro, the people who had the original SARS virus, SARS-CoV-1, and then got vaccinated had really significantly boosted levels to a whole broad spectrum of the beta coronaviruses, of which this SARS are a family. So the beta coronaviruses, which some of them are pre-human, some of those are in animals right now and haven't transmitted to humans yet. Some of the beta coronaviruses produce colds and other things. They looked at the panel of those viruses, and that particular group, SARS-CoV-1, they had immunity from that 17 years later, and they got the vaccine for SARS-CoV-2. So CoV-1, CoV-2 are the same family, but pretty different viruses. 80% is similar in their genetics, but they're significantly different. So they basically got immunity from two very different viruses. And the combination of that immunity gave them broad spectrum antibodies, at least in the test tube. All right, it's very interesting. The idea that you could do a cross clade or cross viral vaccine from two different receptor binding domains, like our spike protein that we have on the SARS-CoV-2 that we've used, and maybe the spike protein from the SARS-CoV-1, put those into one vaccine, which shouldn't be too hard when you're dealing with mRNA, you may get augmented and broad spectrum antibodies to other coronaviruses. That's a very interesting study. It's very preliminary. It also brings us to the idea of where we're going with this pandemic. So this information, this research kind of informs where we can go. I don't think we're going to eradicate this virus. I think we're going to develop antibodies that are broader spectrum and that will eventually downgrade these viruses. I don't think that we're going to be able to do it just through natural immunity. So those of you who really are dependent upon your natural immunity, it does work. It does help. Absolutely. But these viruses are so severe, and the death rate is so high, even of our SARS-CoV-2 right now, that we can't just depend on that. So one of our main, it's been from the very beginning, pandemic goals is that we don't want this to spread wild and rampant. We have seen what that happens, and it fills our hospitals and puts us in horrible positions where we're watching so many people die. And we just don't want that. Our health system can't take it. So one of the goals of the pandemic has been from the very beginning, stretch this out. Keep it from hitting everybody all at once, because we just really can't handle it. It's very true. I've been to the hospital. I've watched when we were full in January and February during our third surge. And we had people lying in the halls. It was true. We were full in our ICUs. It's happening now down the south. It's real. We can't just let this virus go unchecked. So we need preventative measures. We need masking. We need distancing when the time is right. We don't have to shut down everything right now, but there may come a time when we do need to curtail activities. I don't know what that future is going to hold. I would just ask people to be flexible. This is important. I'm a regular family physician. I'm not an alarmist in the least. Those of you who know me know that I'm probably a bit of a minimalist. And so when I say this is still important, I hope you understand that I'm not coming from an alarmist position. So our goals for the pandemic are to broaden our immunity. I think in the future that will be true. For right now, we have vaccines that do work very well and can prevent the vast majority of serious disease. They remain very safe. There have been some concerns with side effects. Those have been looked at very closely. The thrombopenic thrombosis from the Johnson & Johnson vaccine is very rare, but we know about it now, and we know how to treat it. Myocarditis from the mRNA vaccines is also very rare in young people. It also is not as severe as it may sound. It can be bad, but it's also very rare, and we can recognize it and we can manage it when people have that side effect. Beyond that, we know the side effects of sore arms, low grade fevers, aches, pains, nausea, headaches. Some of those can last longer than just one day in some people, but the vast majority are taking it fine. Many of us took our shot and went back to work. I took my shot back in December, right in the middle of the pandemic. I was working in the hospital. I took my shot. I went to work. And that's the story maybe people don't hear, is that the vaccine does work for the vast majority of us and the side effects are minimal. So I think it's where we're going with the pandemic right now. Should you get a booster? You make your decision about when you want to get your booster. Don't be in a huge rush for it right now unless you're immunocompromised. And some of you that are working in healthcare fields should probably go ahead and get that booster. But we should be pushing public policy and seeing this as the global pandemic that it is, and do the compassionate and the right thing to share our resources with other countries. When it comes to our goals for this pandemic, we're probably not going to eradicate it. We are going to develop immunity to some of these beta coronaviruses. And over the next few years, I think we may broaden that immunity through vaccination. And I think that will allow us to move on and past these years that will be known as our global coronavirus pandemic. I hope this has been helpful for you. Message me, text me, call me if you got questions. I'm glad to try to help. This has been some good medicine. Thanks.